I would say some of the things are, of course, there's a whole range of things that people can do, but I think there's some basic level, I would say, hygiene factors that we can do to help our mental health. One is good sleep, good healthy eating, trying to stay away from excessive alcohol or foods that they're not, there's a great link between gut health and mental health that's been established in science. So all of that are what I call the hygiene factors. We can look after this. We can make small changes, nothing dramatic, but small changes to make sure these areas are covered.
To like prioritize them, I guess, a little bit more.
Yes, and sleep especially is one massive area. We're extremely sleep deprived as a society. We watch too much TV, we have too many screens, and that impacts the amount of sleep we get. These are things that might sound as they're nothing, but they will have a big impact. In addition to that, being open. Maybe is not right or appropriate at that moment to be open to everyone. We don't want to hang a banner on our head saying, I'm not doing okay. That's not what I mean. But sometimes having a one person that you can come and confide and say, look, I'm not doing okay. I'm having these issues. That starts a process. That starts a process of acknowledging that you're not in a good place. And that might mean that after that, the next step is looking for professional help, or it might be that just talking about it starts relieving the pressure, or it might be that talking to one person makes you feel a bit more prepared to be open with other people around you. And I think that that's the route to find the strategies that will work for each person.
Okay, so that so taking the first big step is to be more open to trust in someone to have the conversation. Yes. I'm guessing, do most people maybe choose a friend, maybe, I don't know, or maybe actually someone who maybe a stranger, maybe someone in complete confidence?
Sometimes it's a stranger. I think for the ones lucky enough to have this kind of friendship that's close and open, that's the right person to talk to. I think that's brilliant. But sometimes you just don't want to open up to your friends. Yeah. That's too much at stake. And talking to a complete stranger can be really transformative, can be that right step in the right direction. So there's several groups that support people that might be going through mental health issues. There's Samaritans, there are other phone lines that can help. If a stranger is the route to start opening up, why not? That's plenty of support out there.
Yeah, someone that doesn't judge you because they don't know you. They just know what you're telling them, and they can look at it from an independent point of view. I can understand the benefit of that, speaking to someone who doesn't know you. Yeah.
And the key thing is, if we're not feeling okay, it's valid. It's not, sometimes we see these comments, oh, that person have the financial resources, has the family, has the nice house, has a nice physique and so on. Why they're not feeling okay? Well, if they're not feeling okay, they're not feeling okay. We have to give them the chance to actually talk about it. So otherwise we won't get to the bottom of the issue.
We have to disassociate from, this material possessions thing. It's absolutely not linked, is it? We can't change our mental health. Sometimes it's just the way it is, isn't it? It's that acceptance, and to talk is a big factor. There's a lot, as you say, we can do, thinking about our sleep, getting quality and quantity. Quality is harder as we get older because we just generally do sleep less. So if you're experiencing that, then obviously you've got to prioritize a little bit more and say, well, maybe I'll try for a little bit more sleep time, going to bed a little bit earlier. Nutrition, yeah, we can all do a little bit more in that. You don't need to become obsessed with it, but just eating a little bit less rubbish and drinking some less alcohol and moving around a bit more. It doesn't need to be a gym membership at all. It could just be a walk to the end of your road or around a park, just somewhere in nature, something in daylight. So little things like that are achievable. But then, yes, also seeking help from someone to talk to. I think most people would say that they benefit, their mental health benefits when they're able to talk with someone. Yeah, for sure. Great. Okay. So as Tatiana said there, you know, if you are affected by this episode and the topic of mental health, then please do, of course, reach out to a medical health professional, someone who can listen, someone who can support you. Please everybody just keep talking. That's, I guess, the key thing for us, isn't it, Tatiana? The communication message is the one that's key out of this, for this topic.
Yes, and understand that we all have different phases in our lives, and it's fine. It doesn't, mental health issues doesn't choose particular groups of people. They can happen to anyone. And actually, Jeanette, I'm just going to give one final thing. For the ones that are okay and doing fine, it's always nice to be a bit more open to ask the person next to you. They might look fine, but they might not be fine. So asking the question sometimes can open up the window for that conversation to happen, and can be a really generous act to someone else. So
yeah, very considerate. So, you know, not just saying, how are you? No, really, how are you? That kind of reinforcing the question, it kind of makes you stop and think, oh, they genuinely are interested. So yeah, that's a really good point. It's something that we can all do, just to check in with people, friends, colleagues, partners, etc. It's a valuable thing to be able to do.